Hey, it's February 6, 2023. I'm out here next to the Kootenay River talking healthcare. Got Violet, my guard dog, and she's having fun with all the sights and smells. So what brings you hope? Well, through all my work as a small town family doctor over the years, the moment that is filled with the most hope is the birth of a newborn. Amazing. What a privilege to be part of a season of renewal and all the expectant joy that brings new families. Well, healthcare's big in the news this week because the premiers and the prime minister are going to be meeting, and they're supposedly talking about, upgrading the funding mechanisms. Okay. Been a long time coming for this current prime minister. He hasn't really done much on that file, period, in 7 years, but I'll take a little bit of action. But what could bring us hope on the healthcare file? Well, let's start by taking a step back and, reminding us all that healthcare is predominantly a provincial jurisdiction. That's how it's administered under the Constitution. But the federal government does play a role, and they send tax points and cash dollars in form of the Canada Health Transfer to the provinces in order to help facilitate that. And let's also remember that there's this big umbrella piece of legislation called the Canada Health Act, and it's got these 5 principles. The 5 principles are: it should be publicly administered. Okay, that's how the insurance programs are set up. Fair. Should be comprehensive. Well, bit debatable. We do a decent job in Canada in covering the essentials, that's for sure. It should be universal. Well, it's available to everybody, absolutely. You just have to register through your provincial government. It should be accessible. Gotta think about that one, because is access to a waiting list actually access to healthcare? And it should be portable. And aside a few little interprovincial snafus, it mostly is. So, okay, is that enough? Is the answer just let's dump a bunch more money into healthcare? No, not the answer. Not enough. My basic point of view is we need to add 2 more principles to the Canada Health Act. It's got to be timely. You've got to be able to access this particular health care need that you have in a fashion that actually meets the need timely. Now, for each individual procedure, there's going to be different parameters, but, there's no debating that that's a mandatory part of things. And the other thing is, we've made a bureaucratic subculture out of healthcare everywhere. The bottom line is that having the government set all the rules, having the government do all the administration, and having this big government-run bureaucracy just leads to inefficiencies and inequities everywhere. The dollars need to be patient-centered. If money flows with a patient as to where in the system they are, and the dollars only get delivered when the patient gets something done, man, you'd start cutting through some red tape. And this obsession with, we can't be the United States. Well, nobody wants us to be the United States. I don't. But there is a lot of systems in Australia, New Zealand, Scandinavia. We should start emulating. And you know what? They have parallel system delivery. And it's okay to have just a little bit of innovation and a little bit of absolute optimization that's possible with thinking outside the box and having more than one outfit deliver a service. Those are my thoughts. Talk to me about what you'd like to see in healthcare. What would actually bring you hope? I've laid this all out on my website at jimweidrich.ca. Have a read of the writing that I did there, and share this with a few friends. Feed your feedback to me. I want to hear it. Thanks.